Improved trade relations among African countries has been identified as one factor that can galvanize the economies of the respective countries. Nigeria, for instance, is working on a new strategy that can boost export to other African countries. In this episode of the program, we will focus on this development as well as female health issues in the continent, with emphasis on genital schistosomiasis. I am Charles Alpha, welcoming you to Africa Weekly. Export of goods to other countries is a veritable way of economic diversification and foreign exchange earnings. That is why African countries, including Nigeria, are adopting a new strategies to improve export. Now, let's take a look at the export of the Nigerian Export Promotion Council.
Trade exchange between Egypt and Nigeria continues to witness remarkable growth, as trade figures in the first quarter of 2021, according to the Bureau of Statistics, grew to 11.7 trillion naira, while export trade is put at 5.7 trillion naira, with import trade pegged at 5.9 trillion naira. To sustain the gains of the trade volume between the two countries, the Nigerian Export Promotion Council established Nigerian's Trade House in the Samad industrial area in Cairo, where commodities such as sesame seeds, ginger and groundnut will be processed and distributed to countries in the North African region and beyond. The Executive Director of the Nigerian Export Promotion Council, Dr. Ezra Yakusak, explains that the initiative is targeted at increasing Nigerians' foreign exchange earnings and creating jobs while serving as a major source of income for exporters.
This is the after product of sesame. When you have processed with cleaning with water, because it is 100% clean, Europe is buying to put inside biscuit.
The NEPC is also collaborating with the private sector to promote made in Nigerian goods and services in regional and international markets, with additional trade houses established across Johannesburg, Nairobi, Hunan in China, Saudi Arabia and Lomé, Togo, to drive Nigerians' non-oil export with takeoff of the African Continental Free Trade Area.
All right, joining me now live in the studio to discuss this further is the Executive Director and Chief Executive Officer of Nigerian Export Promotion Council, Dr. Ezra Yakusak. We are pleased to have you, Doctor, on Africa Weekly.
Thank you very much. It's glad to be here.
Okay, now I need you to tell us what you know on the current states of trade volume in between Nigeria and other African countries in terms of exports.
In terms of export, trade volumes between Nigeria and other African countries is generally low. And it's not only a Nigerian thing, it is what is applicable in Africa generally. And let me give you the statistics. If you look at the trade, inter-African trade is about 18%. I mean, continentally, it's about 18%. While comparable to Latin America, which is 35%, and Europe is about 60%, Asia is about 40%. You will agree with me that inter-African trade is low. Now, coming back home to Nigeria, the top 10 destination, export destination in Nigeria for 2021. If you look at it, the top 10, we have the first, of course, is Brazil. Then we have China. We have Netherlands. We have the United States of America. We have Belgium. We have Japan. We have Vietnam, Germany, Malaysia, and of course UK. That's United Kingdom. If you look at these countries I mentioned, the top 10 in 2021, you realize that an African nation is not one of the top 10. And that means we need to do something about that, because the trade volume is very low. And I'm sure that's what informed the establishment of the African Continental Free Trade Area, where the need for economic integration, promotion of trade within African states was established. Generally speaking, trade volume between Nigeria and other African countries, comparable to other places, it's low.
Okay, now talking about being low, so what has been responsible for this?
Now, there are so many factors that are responsible for it.
Okay.
Number one, because mostly, not only Nigeria, Africa, you realize that we deal with mostly commodities. And mostly commodities. And these commodities are what the Western world require to boost their industries. For example, cocoa. You will agree with me that most of our cocoa are not very processed. A high percentage of our cocoa is not processed. It is sent raw out there, and they produce it, process it, manufacture and bring back chocolate to us here, for import, as import. And so, one of the issues, like I said, is mostly these people, they have the industries, the Western world, they have the industries, they are well industrialized, and they require the raw materials, to enhance their industries. This is one of the reasons why the trade volume is low between Nigeria and other African countries. Okay,
now, so what informed the concept of establishing trade houses, by the Nigerian Export Promotion Council in other countries? Well, what's going to what you have just said is the problem or the factor responsible for this low trade.
Now, we brought up the idea of establishing export trade houses in other countries in Africa because of the need to cope these low trade indices between Nigeria and other African countries. And we also wanted to leverage on the African Continental Free Trade Area and access the African market because, see, upon the establishment of the AFTA, we felt the need to ensure that we take a proactive step to ensure that African markets are accessed by our exporters. And so we set up the export trade houses. The first one we set up, which was launched about 2 weeks ago, is Egypt. The next one is going to be in Lomé, Togo. That's the next one to be launched now. And the idea is to ensure a seamless facilitation of trade by sending our goods, Nigerian goods, to those countries, and they'll be kept in a storehouse or in a warehouse, and the people from that country and other neighboring countries will come right away and have access to our products. So now, what is the Nigerian Export Promotion Council, doing to overcome, this challenge? You have really, identified clearly, no doubt, these problems, what they are, but what are you doing to tackle them? Now, okay, let me take packaging, for example. We have a packaging unit, and what we do is to go out there and sensitize exporters via workshop, trainings, and other means to ensure that they improve in their packaging. Now, we do that very well. And in terms of certification, we initiated a program called Go Global, Go Certification. Mm-hmm. And that initiative or that project is to ensure that we invite Nigerians, people with products that have good export potentials and facilitate their certification with other certifying body. Last December, we facilitated the certification of about 36 firms or SMEs here, and we presented them their certificate. NEPC paid the total package, and very soon we are going to announce inviting people with products that require such certification. We are going to announce them to come over and with their products and their needs, and we'll see how we can intervene in that area. Okay, one of the things I also want to mention in terms of constraint to export is the port congestion. You are aware that, to export from Nigeria, it's a Herculean tax, and due to the port congestion. In fact, it has been said that Nigeria loses about $14.2 billion every year due to port congestion. And we are also aware that to export a 40-foot container from Nigeria to China, it's about $3,500, a journey that takes about 22,000 kilometers. Now, to transport that same 40-foot container from the port to mainland in Lagos, the same state, will take about $4,000, a journey that lasts only 12 kilometers. So that's to show you the sorry state of our ports. So that's actually an impediment to non-oil export. So because of that, in NEPC, we initiated a program called the Domestic Export Warehouse Scheme. It's a warehouse where we identify a warehouse and we invite all the agencies involved in export, like Custom, like the Quarantine Service, like NAFDAC, and other agencies. It's a one-stop place where people will come and bring their goods for inspection, for weighing. Even the pre-shipment inspection agents will be there. Once the goods are okay, the goods will be shipped or will be loaded in a truck, and the truck will be marked due. That's DEW, due. Once that truck is marked and sealed, it's going straight to the port. And of course, the truck will have a platform where the truck is going to be tracked. So
now, Doctor, in the next 5 years, I need you to paint a picture of what you would like to see. I'll give us a projection in the next 5 years.
Well, in the next 5 years, what I want to see is to, I'm seeing a situation whereby Nigeria will be dominant in the export ecosystem. Nigeria will be very dominant, especially in the African sphere, because we're going to leverage on the African Continental Free Trade Area, and that's what we're doing now. And of course, we are also going to key into the RT 200 Forex program initiated by the Central Bank of Nigeria. We are partners in this, and so we're going to key into that and ensure that in the next 5 years, we are going to, Nigerians will experience an inflow, a Forex inflow of about 200 billion US dollars as projected by CBN.
It's all right, Dr. Ezra Yakusak. Thank you for your time with us on Africa Weekly. Thank you for sharing your thought with us.
Thank you very much.
All right. Now, Dr. Ezra Yakusak, the Executive Director and Chief Executive Officer, Nigerian Export Promotion Council, sharing his thoughts on enhancing trade relations in Africa, the Nigerian Export Promotion Council impact. A military court in Burkina Faso on Wednesday handed down a life term to former President Blaise Compaoré over the 1987 assassination of revolutionary leader Thomas Sankara.
Former President Blaise Compaoré, who lives in exile in Ivory Coast after being toppled by public protests in 2014, and Hyacinthe Kafando, who has been on the run since 2016, were tried in absentia. The 6-month trial, which was punctuated by a coup d'etat in January, brings the curtain down on a 34-year saga. The case has been avidly followed by many in the landlocked Sahel state, for whom Sankara's assassination remains a dark blot on the country's history. A fiery Marxist Leninist who blasted the West for neo-colonialism and hypocrisy, Thomas Sankara was gunned down on October 15, 1987, little more than 4 years after coming to power as an army captain aged just 33. The court in the capital Ouagadougou found Compaoré, Kafando, and Diendere all guilty of harming state security.
A former Sudanese militia chief led a campaign of murder and rape and torture across Darfur, the International Criminal Court heard on Tuesday, as the first trial for war crimes in the region got underway. Ali Mohammed Ali Abdurrahman, an ally of deposed Sudanese strongman Omar al-Bashir, faces 31 counts of war crimes and crimes against humanity for his role in the conflict almost 20 years ago.
Do you understand the nature of
The first trial of a person accused of war crimes and crimes against humanity in Sudan's Darfur region started Tuesday at the International Criminal Court (ICC) in The Hague. Ali Mohammed Ali Abdurrahman, former leader of the pro-government Janjaweed militia, is accused of 31 counts of war crimes and crimes against humanity allegedly committed in Darfur between August 2003 and April 2004. The Darfur conflict began in 2003 between Sudanese government forces backed by militia groups known as the Janjaweed, fighting against mainly non-Arab Darfur rebel movements, angry over discrimination and neglect on the part of central government. Hundreds of thousands were killed and several million displaced by the brutal fighting. The Janjaweed were widely accused of committing ethnic cleansing against the civilian population, burning and raiding hundreds of villages. Ousted former president of Sudan, Omar al-Bashir, is also facing genocide and war crimes charges, but has so far evaded arrest. He is currently in custody in Sudan following his removal from power in 2019.
Healthcare is a big challenge in Africa. And among women, many health issues are left unattended to, leaving them vulnerable to diseases and poverty. Now, the spread of schistosomiasis among women is on the increase, and now is a time to raise awareness on it and provide the needed care for sufferers.
Female genital schistosomiasis, a complication of chronic infection of schistoma hematobium, is a neglected gynecological disease entity that affects girls and women. It is underreported and misdiagnosed and rarely discussed and mentioned among healthcare professionals. Experts say it is a public health problem affecting over 56 million girls and women in sub-Saharan Africa. Apart from pilot study done in some communities in Nigeria in 2016, there are no studies in Nigeria concerning female genital schistosomiasis. Thus, the burden of female genital schistosomiasis is not known. Female Genital Schistosomiasis Network was created in October 2021 to link up the FGS scholars in Nigeria and those lectured by the scholars with the aim of creating awareness about FGS. Both preventive and curative treatments with praziquantel targeting both in schools and out of school children at community level, they say, should be applied so that girls will benefit from life course management of FGS and related infectious diseases and cancers in Nigeria and world over.
Joining me now live in the studio to discuss this issue further is Dr. Ibrahim Rabiu, and he is the President, Female Genital Schistosomiasis Society of Nigeria. Dr. Ibrahim Rabiu, thanks for coming. Good to see you on Africa Weekly.
Thank you.
Okay, now tell us what you know about this disease called female genital schistosomiasis, and what population of people does this disease affect most?
Thank you so much for the question. Female genital schistosomiasis, otherwise called FGS, is a public health disease that affects girls and women in schistosomiasis endemic area. It is a neglected disease entity among neglected tropical diseases that affects about 56 million girls and women globally, mostly in sub-Saharan Africa. It is a disease condition where eggs led by the adult parasite of schistosomiasis migrate and become trapped within tissue that elicit immunological responses that otherwise give to disease called female genital schistosomiasis. It affects mostly girls and women in an endemic area where schistosomiasis is found in Nigeria.
Okay, now, so what symptoms does it present with? What are the risk factors? How can this, be managed, and how can it be prevented?
Female genital schistosomiasis mimic a sexually transmitted disease, but it is not a sexually transmitted disease. Otherwise, it presents with symptoms similar to sexually transmitted disease, such as vaginal itching, feeling of burning sensation around vagina, vaginal discharge, menstrual abnormality, spottings or bleeding during sex or after sex, and painful sexual intercourse. The risk factor of this female genital schistosomiasis is unsafe water, where people are not provided. They have to go to the streams and rivers to get water, and come in contact with contaminated water of this schistosomiasis.
Okay, now you are the president of the Female Genital Schistosomiasis Society of Nigeria. What role is your society playing, in creating more awareness, on this disease?
Thank you so much for the question. Female genital schistosomiasis as a disease is the awareness among the health professionals, the publics, is very low, and we have been trying to create awareness by organizing trainings at health institution. We have done one in Federal Medical Center Abeokuta. We have done one in Federal Medical Center in Lokoja. We've done in Delta State Specialty Hospital in Kano, and also have done one in Delta State. We have done one in Bauchi State Specialty Hospital in Bauchi, and we've done one in Abuja University Teaching Hospital recently, last week, and we are going to do more just to create awareness. And also we need assistance of the media to also help us spread out this information so that people will get to know that there is a disease entity called female genital schistosomiasis that affects girls and women that live in the village. And with the help of virtually everybody, I think the awareness will be created and people will be aware, and then they will come to the hospital where it can be treated.
Okay, now, so if you say this disease is gotten from exposure to some certain waters, are you saying that the female, so to say, shouldn't have contact with water, or what should they do to to prevent this from happening to them?
Thank you so much for the question. Female genital schistosomiasis is one of the diseases that's misdiagnosed because it's not, the awareness is not there. People, it presents just like sexually transmitted disease. As I said, it's not a sexually transmitted disease. You cannot contact it by having sex. It's normally contacted when you have contact with contaminated water. And as I said, that in most of our communities, open defecation is still a problem. That's this where we need the policymaker to provide safe water, to the people where they can get industrial borehole instead of going to the stream to fetch water to wash things. Even for farming, irrigation, should be well constructed so that to take care of this disease. And people should stop defecating anywhere they see, inside water or at the surface, where the drainage need to be washed down to the stream.
All right. Okay. So now just one more question before I let you go. Now, for those who have this disease, the female genital schistosomiasis, what is your own society doing to help them?
Yes, thank you so much for this question. Female Genital Schistosomiasis Society of Nigeria, we tend to help those with the disease at community level, at family level, and then at individual level by collaborating with various partners within Nigeria, academicians, politicians, and ourselves, and then we work in a multidisciplinary approach to solve the problem, with these diseases and help the people that has this disease.
Thank you so much, Dr. Ibrahim Rabi, for your time on Africa Weekly.
Thank you for this opportunity. We are very grateful.
It's all right. All right, so that was Dr. Ibrahim Rabi, the President, Female Genital Schistosomiasis Society of Nigeria. Well, that's our package this week on Africa Weekly. Many thanks to you for being part of it. I am Charles Alpha.